Hi, and welcome to my PowerPoint presentation. My name is Gutama, and today the topic that I'll be covering in this presentation is called crisis management. I would like to start by honoring the land that we are on, which has been the site of human activity since the time immemorial. It is the traditional territories of the Huron-Wendat, Anishinaabe, the Chippewa, the Haudenosaunee Confederacy, and more recently the Mississaugas of the Credit River First Nations. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements agreed to peacefully share and care for the land and its resources. Other indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are all treaty people. Many of us have come here as the settlers, immigrants, newcomers in this generations or generations past. We are mindful of broken covenants, and we strive to make this right with the land and with each other. I would also like to acknowledge those of us who came here forcibly and involuntarily, particularly as a result of the transatlantic slave trade. And so I honor and pay tribute to the ancestors of African origin and descent. Why does doing a land acknowledgement matter? That's because we are paying respect to a tradition that indigenous people have been practicing for centuries. Land acknowledgement is an act of reconciliation. Agenda. I will be covering the 7-stage model of crisis intervention when you are finding a person in a crisis situation. These are the 7 steps that you should be able to go through once you get a familiarity of the process. And then finally, I will teach you resiliency. So Roberts created the 7-stage model of crisis intervention in 1991. The first stage is stage 1, and it's the planning and conduct of crisis management. Stage 2 is establish rapport and rapidly establish relationships. Stage 3 is identify major problems. Stage 4 is deal with feelings and emotions. Stage 5 is generate and explore alternatives. Stage 6 is develop and formulate an action plan. And stage 7 is establish a follow-up plan and an agreement. So stage 1, plan and conduct a crisis management. This is where you identify the risk factors. This is when you must assess the client or the person you deem is in a crisis state. You have to determine if this person is in imminent danger. For example, a drug overdose, suicide attempt, sexual assault, violent crime, or domestic violence. If the person answers yes, then you have to inquire further to determine a safety plan for them. Other things you need to keep in mind is whether the person may be suffering from major depression, intense anxiety, phobic reactions, agitation, paranoid delusions, acute stress disorder, adjustment disorder, personality disorder, post-traumatic stress disorder, PTSD, or just sleep disturbance. Stage 2, establish rapport and rapidly establish relationships. The main goal is to establish a rapport by conveying a genuine respect for the person you are supporting. You're not here to diagnose the person with their symptoms or anything like that. The person needs assurance that he or she or they can be helped and that you can provide a safe place to receive such help. Stage 3, identify major problems. The focus should be on now and how, rather than then and why questions. You should explore these dimensions through open-ended questions. Example of open-ended questions that you can ask are, when did this event take place? Or you can ask, what situation or event led you to seek help at this time? Stage 4, deal with feelings and emotions. It is therapeutic for people to vent or share their feelings and emotions in an accepting, supportive, private, and non-judgmental setting. This process helps the person to get to the essence of the real problem. At this stage, you're just mostly just listening and listening to the information that they are willing to share with you. The more you make them feel comfortable, the more they'll provide you information. Stage 5, generate and explore alternatives. This is where you explore and assess their past coping tactics. Educate the person when modifying or creating new coping behaviors. At this stage, we use solution-based therapy. This method emphasizes working with the person's strengths. Most youth and adults have developed several coping mechanisms, some adaptive, some less adaptive, and some inadequate as a response to the crisis event. It is important for the crisis intervener to attempt to bring the conscious level the person's coping responses that now operate just below the surface at the pre-conscious level, and then to educate this person in modifying a maladaptive coping behavior, like how they can solve the current crisis situation. Specifically, it is useful to ask the person in crisis how they normally cope, such as feelings of intense anger, loss of a loved one, a child or a spouse, or disappointment or failure. Learn from their past on how they've coped in similar situations. Solution-based therapy should be integrated into crisis intervention at this stage. So again, this method emphasizes on working with the person's strengths. Stage 6, develop and formulate an action plan. So the first part here is the cognitive approach. The best way to help a person who's in a crisis is to use a cognitive approach to help the person in crisis to focus on why a specific event leads to a crisis state, and simultaneously, what this person can do to effectively master the experience and be able to cope with similar events should they occur in the future. At this stage, you're helping the person to understand the event's specific meaning, how it conflicts with his or her expectations, their life goals, and belief system. When you're providing this support, you should listen carefully and note any cognitive errors or distortions, like for example, overgeneralizing or irrational beliefs. You should avoid prematurely stating the rational beliefs or reality-based cognition for this person in crisis. Instead, you should help them discover distortions and irrational beliefs. Next part is help them create an action plan. This is where you're helping the person to find the hunger or drive to create a discipline in knowing how they can solve their situation. We know this is not an overnight process. You must encourage the person who are in distraught to move away from just a cognitive thinking and actually create an action plan. This is where you want the person to obtain a realistic understanding of what happened and what led to the crisis. To move beyond the crisis, the person must understand what happened, why it happened, who was involved, and the final outcome. Example, being locked out of one's house, a suicide attempt, the death of a friend, a divorce, a child being battered. Next is make small, gradual, everyday changes. You can help the person in crisis by teaching them to make small, gradual, everyday changes. This will help the person in crisis to understand what that self-inflicted adversity can do to them in the long term if it's not addressed. In this stage, you're helping the person to restructure, rebuild, or replace irrational beliefs and erroneous cognition with rational beliefs and new cognition. That makes sense. This may involve providing new information through cognitive restructuring, homework assignments, or referrals to others who have lived through or mastered a similar crisis. Example, a support group for widows, for rape victims, or for students who have been confronted with school violence. Stage 7, establish a follow-up plan and an agreement. The plan is highly individualized. Explore therapy and medication plan here. Be supportive and don't push the person because of their symptoms. Speak in a calm and quiet voice. Focus on one topic at a time. Encourage the person to plan pleasant activities. Be patient regardless of the decision they make. And most importantly, stay connected. Establish that follow-up plan. Finally, resiliency. Everyone experiences stress and difficult circumstances during their life. Most people can handle these tough times and may even be able to make something good from a difficult situation. Resilience is the ability to bounce back after experiencing trauma or stress, to adapting to changing a circumstance and respond positively to a difficult situation. Again, resiliency is the ability to learn and grow through the positive and the negative experiences of life, turning potentially traumatic experiences into constructive ones. Being resilient involves engaging with friends and family for support and using coping strategies and problem-solving skills effectively to work through difficult situations, through difficulties. Comes to the end of my presentation. So I just want to say thank you very much for taking the time to staying through to the end of this presentation. And I wish you have a great day. Take care. All the best. Bye.